Now that we've looked at the different elements of the health and local government system in some detail, in Section 5 we aim to bring it all together to help you make more sense of what is happening in the area where you live and work. First, let us remind ourselves of the main organisations which we would typically find in any health economy. Second, let's look at what the main challenges are. And thirdly, let's look at how the 5-year forward view, our national strategy, is aiming to overcome these challenges. First, let us look at the local health economy as shown in our diagram. On the left, local government is represented either by a county council or a unitary council, which has the responsibility of setting up the local Health and Wellbeing Board. This is a partnership board with the NHS. The council also funds the local Health Watch organisation. This is the watchdog organisation for the local population, overseeing both health and social care services. On the right, the NHS will be represented by one or more clinical commissioning groups covering the same area as the council. They buy services from a wide range of different provider organisations. The main ones will be hospitals, primary care, mental health trusts and community services. Now let us look at the main challenges which we face. One challenge has been that, although commissioning is considered by some to have helped drive up quality and improve value for money, relationships between commissioners and providers have often been very difficult. Another challenge is that the public still find it difficult to understand which organisation to go to for which service. This can often result in them going to the wrong place, having a complex and disjointed journey, only to end up in A&E. This, in turn, can mean that inappropriate people end up being admitted to hospital unnecessarily, and then operations which other people may have been waiting many months for get cancelled. Another challenge is that in any typical health economy, the total number of health professionals working in hospitals can often number between 4,000 and 5,000, whereas the number of GPs and other health professionals working in the community will be in the hundreds. Yet, if we look at patient demand, we can see that relatively few people proportionately are treated in hospitals compared to the much larger number requiring help in their communities, if not in their own homes. This fact has also influenced where the money is spent. Typically, a CCG's budget will be divided into the following. 50% at least will be spent on hospital-based care, 20% on primary care and prescribing, including the 4 professional groups, GPs, pharmacists, optometrists and dentists. Between 10 and 15% may be spent on mental health and community services respectively, and a further 5 to 10% spent on other related services provided by ambulance trusts, social enterprises, charities and private companies. So we have developed a system which focuses mainly on hospital care when we need more facilities in the community to avoid unnecessary hospital admissions. The focus tends to be on single conditions, whereas more and more people nowadays are having to manage multiple conditions. There is greater focus and status associated with specialists rather than generalists, which has led to a shortage of GPs. There is greater emphasis given to curing people, when nowadays we are realising many of the conditions people are suffering from are due to lifestyle choices, and these could have possibly been avoided if there had been greater focus on self-care and prevention. So how is the 5-year forward view, our national strategy for the NHS, going to overcome these? First of all, it openly states that the focus in recent years has been on the wrong things and makes it very clear that prevention must play a bigger part. Its proposals include the likely need for legislation, the real possibility of having a sugar tax, and the importance of employers having a greater duty to support their employees' health and well-being, both physical and mental. Next, NHS England has divided the nation into 44 geographical footprints, which often combine several health economies where it makes sense for the hospitals in that area to work more closely together. The leaders of the commissioning organisations, CCGs and councils, together with all the main NHS provider organisations, have been charged with agreeing a Sustainable Transformation Plan, or STP. This is designed to meet the expected changes in the local population's health needs over the next 5 years, within the budget, or control total as it is sometimes referred to, which has been set for that area. These leaders have been required to form a Sustainable and Transformation Partnership, or STP, which collectively is responsible for delivering the plan. Alongside these STP developments, a large number of vanguard projects have been set up around the country. The aim has been to develop models of care which can help overcome some of the main challenges we referred to earlier. These include multi-specialty community-based providers, or MCPs for short. These require services outside of hospitals to be delivered in a more joined-up or integrated way by local providers to avoid unnecessary admissions to hospital. Second, primary and acute care services known as PACS, where either GPs run hospitals or hospitals run GP practices as a means of breaking down the barriers between them. Thirdly, networks of smaller hospitals working together to gain economy of scale and efficiencies through sharing back-office functions and rationalising services as if they were one large hospital. Fourth, integrated urgent and emergency care. Better partnership working between 111 and 999 services and all the various organisations such as out-of-hours services, the various crisis and rapid response teams, A&E, and the various emergency services. And finally, upskilling and providing better support to care homes so that older people can be better cared for there without having to go to A&E. So wherever you are, your local health economy will be part of a wider footprint, and the leaders of the local councils and NHS organisations in your area, whether they're commissioners or providers, now share joint responsibility for delivering the necessary changes to ensure the system can live within its means. It's accepted that the solutions will be different in different places due to local circumstances. So please take an interest in the STP that covers the area where you live and work, and let's see what the future holds. Thank you for listening.